Welcome back to my YouTube channel. If you're new here, welcome. My name is Lillian, and in this video I'm just going to be telling you guys something that shocked me in Ghana. You want to know it? Their healthcare system shocked me. They have insurance here. They have health insurance that covers both the poor and the rich. For those of you that now find it as a trend, stop comparing Nigeria to Ghana. I will. You know why? I'm a Nigerian, and when I want to say something, I would just compare it to, maybe how it works back in my country. So you are no Nigerian than me. You get it? I do what I want. In fact, I compare them. In fact, let me compare them in this video. Let's see what you are going to do down in the comment section. Okay, so joke apart, I'm just going to tell you how the things that impresses me and the things I wish they don't do, but they are doing. Please, this is not about hate or love. This is about my experience. This is my cat. This is, how do I get you to see this? Okay, very good. Very good. What is this? This is La Polyclinic. What name is that? This is Lillian, my surname and my name. This is the date. You can see the date. Hope you can. Now I'm talking about this month. I'm talking about recent. I'm not talking about the past. So they have health insurance that covers their citizens. For you to have the health insurance card, you don't necessarily need to be a Ghanaian, which I didn't know. I did not want to violate any. I wanted to just, try my best to just be at my best behavior. So I didn't know that I could get the health insurance card and start receiving treatment for almost free until I went to the hospital on the 15th. Yeah, I have been sick for some time, and then I just decided to go back again. And so the time, what you see here is, you see polyclinics. When you see that they are all government-owned clinic, and they are very, very, very affordable. When Wendy falls sick, I took her. Wendy has insurance card, health insurance card. I spent almost as good as nothing. The only thing I spent money on that day was the blood test that they did on her. Almost every other thing came at the lowest cost. I was so surprised, including drugs. I paid 15 cedi, 15 for drugs, and I was asking them, "Mama in Ghana?" And they were all laughing at me. Like less than $3. That was what I spent on medication, like drugs. I think they gave me like 2 different syrup for the baby. So their health insurance system, man, guys, is so good. So what I didn't know is, if you do not have health insurance and you fall sick, you go to the hospital, and you are going to pay 35 cedi to get this thing. 35. But if you have health insurance, you only pay 5 cedi. Can you beat that? So I didn't know. I paid 35 for myself. When it was Wendy's turn, I paid only 5 cedi for her. Another good thing again is, even without the health insurance, if you go to these polyclinics, their services are very, very, very affordable. In my case, I did blood tests for 40 cedis. Like I paid, and they did series of tests like malaria, they did pregnancy, they did typhoid, they did all under that 40 cedi. So that was all I spent for the blood test, for the screening of my, like the blood test, all these tests I just mentioned. So, and then when it was time, when they were done, I was given some, drugs, like malaria drugs, and then they included paracetamol, they included some blood tonic, and I only paid the sum of 35 cedi. I was really surprised. So it means that that day I spent 100 and okay, yeah, I paid 2 cedi for this card. Paid 2 cedi to the person that issued this to me. So at the end of the day, I spent 112 cedi in total, and then I received a pack of drugs for malaria drugs for treatment. That was all I spent, which I was shocked. I was really surprised. So it means that if I had health insurance, I would have spent way less than that. So if you are in Ghana or so, because I asked them at the hospital if other people from other countries are allowed to have health insurance, and they said yes. So if here you're looking to be careful because you can fall sick, nobody prays for it. If you want to get the insurance card, it will really help you. So especially if you're here with your kids, you should consider having health insurance card for them. That is one thing I didn't know before. So it was when I took Wendy to her grandparent, they had it done for her. So it's really good. So but then if you do not have health insurance, my beloved, you fall sick. I have gone to almost all the different types of health. The other time I felt sick, like it was like emergency, I was rushed to a private hospital, medical center. I wouldn't say hospital, a private medical center, and I spent some ridiculous amount of money. It's not like they admitted me. Yeah, I know I was really sick of ulcer, and so yeah, they treated me and then helped me. They stopped the pain. Yeah, but immediately after that, they brought bill of 592 cedis for me, a treatment that lasts for less than 2 hours. If I had gone to the government-owned hospital, it wouldn't have been that much. But hold on, I'm going to give you guys the good, the bad side of the government hospital and also the good side of the private hospital. Are you ready for it? See, the private hospitals, like, of course, they attend to you fast. They're really fast to attend to you. The doctors are like, when you just say, hey nurse, they will be there. That's the good side of it. But there is nothing special they are giving to you that you can't get at the government hospital. Like back home in Nigeria, people want to access private hospitals mostly because they believe private is for the rich. You know, you are sure they will take good care of you. But here it's not like that. They are all doing amazing. And in fact, I would recommend you go to the government hospital because you have more than one doctor, you have more than one thing. But the only problem you may have at these clinics is time. You may just end up close to dying before you can be attended to, because there's so many people. There's the day when there's a crowd, and this whole thing is so slow. Like the way they attend to people is really slow. They do not have, like in Nigeria, when you first come, you are the one that first come. Oh, there is no excuse. You should enter when the other person, you know. Here they don't do it like that. Most time, for those of us that don't speak the language, you may be there, like 10 people will enter before you, and the people in charge, the nurses in charge, will tell you leave them, let them go. You, before they speak the language and you try to tell them you don't understand what they are saying, they will tell you sit down and wait. My dear, you will sit and sit for more than, you know, necessary. So they are not very fast, but they are not rude. Unlike our own nurses, where hey, they are rude but fast. Here they are not rude, but they are not fast. You know that snail speed. Sometimes it's the snail speed situation that you get, but at the end of the day, you won't spend so much money and you will still be fine. So I hope that this video is helpful, and I'll see you guys in my next one. Bye.